Good morning, everyone, and thank you so much for joining the first Swedland seminar of 2021. We are giving a few minutes as the attendees are starting to join in as we have just started the seminar. In a minute, we will start with the introductions and the presentations. Thank you so much for joining us. It'll be just a minute. Well, good morning, everyone. My name is Roberto Martinez. I am a four-year PhD student at Case Western Reserve University in the Department of Population and Quantitative Health Sciences. And I also work with Dr. Friedman at the Swedland Center. And it's my pleasure to welcome all of you and to welcome our speaker today as well. Before we start this exciting presentation, we have a couple of announcements for you. The first one is, please, if you learned something today, which I'm sure you will, make sure you can tweet it. And here is our Twitter handle. You can see it in our screen at CWRU Swedland. And tweet and tag us and say, like, what did you learn from about this presentation, or share the presentation today as well. It'd be our honor to hear from you in that way. Second, let me just do a couple of housekeeping instructions. Please, let's agree to be respectful, be patient, and ask questions. We invite you to ask as many questions as you can. There will be a space at the end of the presentation. Please make sure that your questions are asked via the Q&A box, which you should check right now in your Zoom. In your menu of options, you have once you look at it, you have like a bubble and a Q&A. If you hit that, it will allow you to ask questions through there. So please make sure that you do that. And at the end too as well, if you are willing and want to actually ask the question verbally, you just signal me in the chat and I will gladly open your mic at that time. I have a quick request for all of you. Please share your name and the organization that you work with, so that we can have a sense of the many people that are participating in the seminar and how we can share more knowledge with you. But it is also very exciting to hear from all of you and to know where you're coming from as well. So please take a time to share your name and the name of your organization. And it's great. I'm starting to see your names popping in the chat. So thank you very much. Continue doing that. And please, yes, report where you're coming from. I would also like to invite you to go to our training page, to our website, the Swedland Center for Environmental Health. And if you go to our training tab, as you can see here on this screen, then you'll see that the Swedland seminars, it's on the column on the left. And if you click on that, you will be able to see the upcoming days and topics for the Swedland Center virtual seminar series. We invite you today that, as Elizabeth is speaking, that if you like to register for the February 23rd seminar, the Development of Innovative Curriculum and Climate Change for First-Year Medical Students, please take a chance and do it. I think it's going to be a great seminar, as well as it is going to, as today's seminar is going to be. Finally, I'd like to invite you to go to the Swedland Center website as well. Our Swedland Center Virtual Summer Internship application is live. And for those interns, we accept undergrad and graduate students that want to apply. It's already, the application is live and you're welcome to apply. If you know someone who will be very interested in our internship, please also send them the link. And in a few minutes, I will be posting both links to our website in the chat box, so you can take a chance to go and visit our website. Thank you everyone for continuing to report your name and the organization that you work in. Finally, I'd like to introduce our speaker today. It is my pleasure to introduce Elizabeth Benninger. She is a postdoctoral research fellow at Case Western Reserve University And her research focuses on national and international collaborations with specifically aim to promote the health and well-being of children and families with communities experiencing high levels of poverty and violence. Elizabeth, it is our pleasure to welcome you to this seminar, and thank you so much for spending the time to share about your research. I'm going to stop sharing my screen at the moment, and then Elizabeth, you will be able to start your presentation.
Okay, thank you so much, Roberto, and thank you all of you for attending. It's really a pleasure to be here. I'm just going to share my screen. Okay. All right, so today the name of my presentation is Conceptualizing Social Determinants of Neighborhood Health Through a Youth Lens. And I'll be presenting on a study that's actually ongoing at the moment that's sponsored through the Center for Reducing Health Disparities at CASE and Metro Health. So I'm going to start by explaining a little bit more about the status of children's neighborhood environment and what that means. So a children's neighborhood environment is comprised of physical, built, social, and historical features, and all of these features have an impact on child health outcomes. Living in healthy neighborhood environments, for example, can have a strong influence on the physical and psychological development of children in the short term, as well as over the life course. In contrast, neighborhood environments which are lacking in resources to support health contribute towards disparities in child health outcomes. So within US urban neighborhood environments, such as Cleveland, Ohio, significant child health disparities exist across racial, ethnic, socioeconomic, and immigrant domains. For example, disproportionate exposure of children from lower socioeconomic backgrounds to adverse childhood experiences, such as abuse, neglect, economic hardship, discrimination, and victimization, have been implicated as an important contributor to health disparities that are affecting children within our city and other urban communities throughout the United States. So today there's a couple of terms that I'll refer to, so I wanted to define those. The first one is child health disparities. So when I'm speaking about child health disparities, I'm talking about inequitable differences in health based on demographic characteristics of persons under the age of 18. And the other term, which is sort of the opposite of health disparities, is child health equity. So that's children having the same opportunities to survive, develop, and attain their full potential. And that's a definition that is commonly used, but I've also added to this definition that it also means children having the same opportunities to experience happiness and well-being throughout their life course. So from this perspective, achieving health equity is not just about looking towards future health outcomes of children. It's also about viewing children as whole persons in the here and the now, and that their experiences are valid and important, even as young as infancy through adulthood. One of my overarching research goals is to move towards this definition of health equity. So as I explained, and most of you I'm sure are aware, that our world has yet to achieve child health equity. And one useful framework for understanding this disparity is the social determinants of health. The social determinants of health capture the complexity of children's health and their environment. So one common definition is that from the World Health Organization, defining the social determinants of health as the conditions in which people are born, grow, live, work, and age. So you can see in the diagram there, it can include housing, education, social support, access to healthcare services, employment, income, as well as childhood experiences. Aligned with the social determinants of health framework, and especially within the Cleveland context and the context of most urban cities in the United States, is structural racism. So some researchers have identified structural racism to be a key determinant of population health. Others have argued that it in and of itself is not a determinant, but a cascading influencer on all the other social determinants. And I think Bailey and colleagues really capture this definition of structural racism well, and its interconnectedness to the social determinants of health. And they define it to be the totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice. So disparities in child health outcomes that we see in Cleveland, Ohio, and other urban neighborhoods are not random, and they largely follow historical roots of social and systemic disadvantage, which drive inequities in health outcomes. For example, this is a map of Cleveland, a former redlining map, and redlining in Cleveland rated Black and immigrant neighborhoods with a low grade regarding investment desirability. And this really limited residents' access to things such as mortgage insurance and credit. And historically redlined neighborhoods in Cleveland tend to experience greater challenges as it pertains to neighborhood infrastructure and economic opportunity. So what's very important here is that racist policies from the past perpetuated racial segregation and systematically shaped and continue to shape the access and resources individuals have to be healthy and well. So these are some other maps of health disparities that we see in Cleveland. And today, so these are maps from today, the prior slide were maps from the past, but the population of Cleveland today still remains residentially segregated by race. And the neighborhoods with the highest median household incomes are majority white, while areas with the lowest median household incomes are those comprised of the largest Black and Latinx populations. And although this study specifically focuses on Cleveland, this trend in racial segregation and health disparities mirrors that of many urban cities throughout the United States. In addition to the need to further understand the impact of the neighborhood on health disparities which affect children, there also remains a dominant approach in gathering data on children and youth, which relies on adult experts. Additionally, there's a general trend in city planning and public health interventions across the US that have been and remain driven by individuals external to the target neighborhoods, who are viewed to be the experts when it comes to city planning, public health, and poverty alleviation. This has historically led to decisions being made on behalf of the people who they are intended for, excluding them from meaningful engagement in the decision-making and planning processes, and further marginalizing community members who have historically been affected by social and structural inequities. However, we have seen a recent paradigm shift in health and well-being research, not only in the field of public health, research strategies such as community-based participatory research, participatory action research, that have really tried to involve community members as much as possible in all stages of the research process. And this trend is slowly spreading into the area of children's health, which means there's this new shift in focus on research about children to research with and for children. So this type of research incorporates their subjective experiences, insights, meanings, and descriptions. Participatory action research and YPAR are a type of methodology that can be an effective means of eliciting children's views on issues affecting their lives. So YPAR, also known as Youth Participatory Action Research, is a form of participatory research specifically aimed at increasing youth involvement in research and social change. And it really focuses on equality between the researcher and the participants. In our study, we utilize the YPAR methodology to further understanding of how the environment shapes children's health and to develop strategies for improving health outcomes. And so this really is the significance of this study. It's premised on the idea that children and youth should be involved in shaping health policy, systems, and environmental change. So utilizing a participatory action research methodology with children and youth, the aims of this study are to explore the perceptions of children and youth related to how experiences of poverty, stress, and adversity within their neighborhood environment shapes their health, understand how social built and structural resources buffer the potential negative impact of adversity and promote health and well-being, and investigate and prioritize child and youth-centered strategies for creating neighborhood environments which will promote their health and well-being. So today I'm mostly going to focus on the results from phase 1 of our study. So phase 1 included approximately 20 youth ages 14 to 18 from the Central and Clark Fulton neighborhoods of Cleveland. That was what it initially set out to achieve, but we actually had to change our sampling slightly due to a number of factors, one of them being the COVID-19 pandemic. So the sample that I report on today is 14 youth from Central and the near East Side neighborhoods of Cleveland. And we also had a sample of 6 youth from the near West Side neighborhoods of Cleveland. And so as we went about our sampling process, we realized that youth in the city are largely transient, and although they may live in one neighborhood, they also may attend school in a neighborhood across the city, or they may stay part-time with family in another neighborhood. And so some of our youth that we sampled moved throughout our project. But one of the criteria for the youth who I will discuss today was that they either lived in the central neighborhood or spent a significant amount of time in the neighborhood, such as attending school there or community programming. And we also realized something similar in the West Side when we sought to sample children from the Clark Fulton neighborhood and realized that they also were living in various neighborhoods or were frequently moving or attended programming in one neighborhood and then lived in another neighborhood. So we kind of had to expand our neighborhood boundaries and even listen to the youth on how they define their neighborhood, which is different from the boundaries that are set by city planning. We are currently in phase 2 of the project, where we are seeking 20 children ages 9 to 13 from the Central and Clark Fulton's neighborhoods, which is more the near East Side and West Side of Cleveland. And we have so far collected data from a sample of 8 youth from the near West Side neighborhood of Cleveland. Our research design included focus group discussion, photo voice, community walks, community mapping, youth-led survey, and action planning. During phase 1 of the study, we really worked with the youth following a series of lesson plans, which were modified from Berkeley's YPAR Hub, which is an open source resource for anybody interested in doing YPAR work. And so we first went through a series of lessons which taught the youth about what research is and various methodologies, and we allowed them to select the methods that they felt were best for exploring their health and well-being. And so these are some of the methods that they selected. And then the idea is that in phase 2, where we're currently at, a number of the youth have been trained as co-researchers and are now the facilitators of the data collection with the 9 to 13-year-old sample of children. So for our focus group discussions, we had semi-structured interviews that broadly ask questions about the neighborhood, such as what is it like to live in your neighborhood? What do you value? What do you find challenging? We also asked questions about psychological well-being, because we really wanted to look at health holistically to include both physical and psychological aspects. So we asked about happiness and what that meant and how the neighborhood has an impact on happiness and well-being. The participants were also engaged in activities where they use photography to stimulate discussions around their health in their neighborhood. So they were instructed to take photos of spaces within their own community, considering spaces, places, and people that make young people feel happy, unhappy, safe and unsafe, healthy and unhealthy, spaces they value, and spaces that they would like to change in order to improve the health and well-being of young people in the neighborhood. We also accompanied the youth on a walking tour, and we did this actually in a neighborhood external to the youth's community, with the idea initially that we would do it in both communities. And the rationale for this was for the youth to have a reference point to compare the built environment within their own neighborhood with other spaces in the community. So we walked through, for an example, a neighborhood such as Tremont, where there was a lot of infrastructure in terms of housing and restaurants and schools and playgrounds and things like that. And then when we were deciding on to do a community walk within the central neighborhood, the youth decided they'd like to take photos individually so they can capture aspects that we wouldn't be able to cover on a community walk. And then the youth also during COVID-19 pandemic, this happened in the middle of our data collection. They decided they wanted to be responsive to the pandemic, and they developed a survey which they distributed using Google Forms to really find out how youth were doing throughout the city of Cleveland. So they were able to collect data from 131 youth respondents throughout the city. And this survey, along with the other activities connected to this research, helped lead to an action plan that we're currently working on implementing. The data analysis we use is participatory thematic analysis, and this is fairly new to research with children and youth, but it really engaged the participants in the data analysis phase of research projects. Often participatory research will engage young people in the data collection, but not always the analysis itself. So what we did during this process is we hung up key ideas. Well, during each focus group, key ideas and insights were written on large pieces of paper and hung on the wall for the participants to see and comment on. And so we saved these things. We actually had them hung up throughout the rec center room, which we were using. And we had a brief discussion of the insights from the focus groups, and the youth were provided with sticky notes where they could write down key themes and ideas that came up from the focus groups. We also had all of the pictures hung on the walls and the maps that we had drawn. And so the youth themselves came up with the key themes and sub-themes, and then we organized those. And then two members of the adult research team used the in vivo software to find quotes from the focus group discussions that complemented the themes that the youth had come up with, and compile the report that was supported by some more of the data from the focus groups. And then the youth approved the report, and a number of the youth volunteered to help us write up a final report to share with stakeholders. And so when we discussed with the youth how we wanted to disseminate our findings, because we were in the middle of a pandemic and we were very limited to meeting in person, they wanted to do a PowerPoint presentation where one of the youth volunteered to provide the voiceover to share with important stakeholders in the community. And so not only was this responsive to the pandemic, but also it was responsive to the youth feeling very intimidated to speak in front of adults. And so they felt like they felt more comfortable recording themselves and then sharing that with adults rather than trying to provide a live presentation, which can be very intimidating for young people. So rather than me verbally report on their findings, I'll share this presentation with you now. And Roberto, once it plays, if you could just let me know if the sound is working okay.
Thank you for taking this time to listen to this presentation. My name is Marcia Robinson, and I am a member of Resilient Youth in the Central Neighborhood. Over the past year, the Central Neighborhood's Resilient Youth participated in a YPAR project in collaboration with a team of volunteers, researchers, and community outreach specialists from Case Western Reserve University, St. Vincent, and Sisters of Charity. The aim was for the youth to express their perspectives on what influences the health and well-being of young people in the central neighborhood and to create youth priorities and action plans for supporting a healthier, happier, and safer community environment for young people. The project included discussing some of the roots and branches of community issues. For example, the branches included crime, school dropouts, addiction, domestic violence, vandalism, incarceration, and shootings in the community. We spoke about the root causes of these community issues to be a lack of living wage jobs, an unfair education system, inadequate housing, isolation, trauma, poor parenting, and broken relationship with the police. The project also included taking photos around the community and other communities and drawing community maps to discuss the community environment and how it influences the well-being of youth. Crime was one of the most pressing issues because of its impact on everyone in the community. Crime makes it unsafe for youth to be outside and to be active. It can even make it unsafe to be home. Crime also results in people losing their lives. It has a negative impact on the home environment and on businesses. Solutions to address crime in the neighborhood include more police activity that is specifically targeting the hotspots where drug dealers are selling drugs and where they are living. It should not be targeting young people who are not doing anything wrong. We need to build relationships with the police where they are on our side to help fight the crime in our neighborhood. Other solutions to address crime in our neighborhood need to look at addressing poverty through providing quality jobs that pay well. People turn to criminal activity when they do not have opportunities to jobs, and not just any jobs, but jobs that pay decent wages. Mixed income housing in the neighborhood will also help so that low income housing isn't so condensed in one area. This needs to be built without kicking the existing people out because they can no longer afford it, like has happened in other Cleveland neighborhoods. We also need community events that build trust and bring people together for fun. Related to crime in our neighborhood was the need for safety. This seems to tie it all together. Issues around safety included the need for safer ways for kids to cross the busy roads that run through our neighborhood, safety in the food that we eat and the food that is available for our health, and safety from the violence. For the most part, we spoke about our houses or apartments as good and safe places in the community where we can have some peace. The location, which is close to downtown and other shops and businesses, is also nice. We also spoke about the social benefits of living in apartment complexes, but also our frustration that people are often getting into other people's business and creating drama. We also have to deal with shooting around our apartments and houses, which can make it unsafe for us to live there. Cleanliness is also an issue around where we live. Even if you like it to keep your apartment clean, neighborhoods will often trash the shared spaces, which makes it ugly. Some solutions to help with our housing issues include things we can do personally, such as not contributing towards social media gossip and surrounding ourselves with positive people. We also need to organize more community cleanups for our neighbors to keep our shared spaces clean. We need to support the government officials and funders to create nicer mixed income housing options and to build nicer facilities like what we see in the suburbs. We would like up-to-date rec centers and large water parks for the kids. We need more green spaces with picnic tables and nice playgrounds. We also would like to have more variety of stores and restaurants in our neighborhood. Social influence is another topic that affects our well-being. Parents have a huge influence instilling values and feeling of self-worth along with behaviors. Peers also have a huge influence. That's why we feel it is important to be role models for younger kids by working hard to be good at things such as basketball or school. That also means that we need to avoid bad behaviors such as gang and criminal activity. To address the impact which social influence has on our lives, we think there needs to be more support for mentoring programs where older youth in the community mentor younger children around fun activities, sports, reading, and healthy behavior. We also need to create more programs that engage parents and their kids so they can develop positive relationships. We need continued support for positive youth programs like Resilient Youth that teach us skills and expose us to new things. We also need support for fun activities like sports and art, which are healthy outlets for youth. Community activities provide new opportunities for young people to be exposed to new people, places, and skills. They are also important for building community trust and safety. In summary, here is our group's ideas for actions, and we need your support. Support more community events for families. Youth can lead activities, teach different skills, and mentor younger kids. Existing programs such as those run through the library or rec centers need to include new opportunities based on a variety of interests, including sports, reading, entrepreneurship, and the arts. Programs also must include meeting basic needs for health, food, and safety. Programs should also include parents too. We need regular community cleanups and to create ways to engage neighbors in keeping our spaces clean. We need to create more safe ways for children to cross the street. We need more green spaces in the community for people to enjoy. We need updated facilities in our community, such as a nicer rec and bigger park for kids. We need our education system teaching kids what they need to know to live healthy lives and to reach their potential. We also need schools to provide access to better facilities and resources for learning. Thank you so much for listening to our ideas. We hope you will take action.
Okay, so I think they definitely presented the findings much better than I could have. So I'm really grateful to Marshall for volunteering to provide the summary for us. The last thing that I wanted to briefly report on was the youth-led survey. And so this was a survey that was designed by the youth, as I explained, in collaboration with some other youth organizations and youth networks, such as the Resilient Youth and MyCom. And so it was distributed, and that we developed an infographic based on some of their responses. And so this was distributed from April through August of 2020. And so it covered some key things like how Cleveland youth were doing during the pandemic, biggest challenges that they were facing, how their mental health and well-being was being affected, how families were doing, and what youth were doing to stay healthy and well. And so this really helped us, along with other youth service providers, to be responsive to some of the needs that young people were facing during the pandemic. And so the next phase after doing the data analysis was the dissemination. So the youth created the PowerPoint. It has been distributed to members of City Council, community development organizations, and some local foundations. We formed an action committee out of this project. So we had 14 youth, 5 of which were interested in continuing on as members of the action committee. All were invited, but due to various conflicts or just honestly Zoom fatigue, since most of our meetings have been virtual, we have 5 who we continue to work with. We continue to meet weekly. We've developed a detailed proposal to work towards the implementation of our action plan. So we've been really working to collaborate with local organizations on getting this plan into place. And really what it comprises is a youth peer mentoring program in which high school youth will mentor younger kids. They will be compensated to do the mentoring. It will hopefully be in collaboration with existing organizations such as the Friendly Inn, the Rec Center, Boys and Girls Club, and they will provide a variety of activities as they reported on to support the healthy development and safety of younger kids, such as fun activities that are interesting to kids, along with some educational activities related to education and health and well-being. The youth have also been involved in the city's declaration of racism as a public health crisis. And so they're working with city council members to try and provide some support and youth perspectives on any actions that may come out of that. Some of the next steps to our research. So the youth from phase 1, from the east side and the west side of the study, of the west side communities, have been hired as youth interns, and they have been trained to facilitate the study with a sample of younger children. Something notable here, I know I didn't address too much about the west side results. This was because we actually started with them, and then the next week we had we started with them later than the central area. And a week after we started, the governor issued the stay-at-home orders, which was back in March, I believe. And so they stayed engaged for a couple of months, but it was really difficult at that point to recruit new participants. So we did work with the 6 participants who we had, and we did collect, we sort of had a condensed version of this project. It was difficult for them to do things like photo voice because it was very scary to go out in the community at that time when so much was unknown from the pandemic. So we did do individual interviews with the young people, and we're working on analyzing that data, but they also continued on with us, and they were trained to be co-researchers, and they piloted a remote version of this project with 9 to 12-year-olds from the east side, which happened November through December. And so we're also working on analyzing those findings. It was definitely challenging working with this age group remotely, especially because Cleveland schools have also been remote all year. So there was a lot of, some of the children explained that they were just tired of being on Zoom all day, and then to join another Zoom project was just too much. So it was challenging to have consistent attendance. And so we're really hoping to collect additional data from this younger age group, but we're waiting until it's safer to do so in person, because we feel the youth have expressed, and the children, that this is really the format that they would like to participate in this project. We also received an award from the Department of Health and Human Services to implement a sub-study with a sample of 20 youth who have children and youth who have experienced an incarcerated parent. So we'll hopefully be launching that in the next couple of months as well. So it will largely focus on the same topics and questions and design, but the sampling will be specific to children who've experienced a parent who's been incarcerated, because their needs may be very unique and different than other children in the community. Just a little bit more about the significance of the study. It's really premised on the idea that children and youth should be involved in informing knowledge based on their health and well-being, and in guiding decision-making, policies, programs, and strategies that are aimed at promoting positive health outcomes for young people. So we really tried our best to place a strong value on the lived experiences of youth, to shape how we understand and conceptualize youth health and well-being, as well as to tailor programs and policies to best fit the youth's context. And it highlights the unique and contextual-based findings related to youth perspectives on their health and well-being. And I just want to acknowledge the youth participants, first of all, for all of their time and effort that made this possible, especially those from the Resilient Youth Group and the Resilient Youth Group leaders, such as Kathy Kopinski, Dawn Glasgow, Mark Silverberg, and the leaders at the Central Rec Center. Megan Schmidt-Sane and Jim Spilsbury, who served as co-investigators on this study. Darcy Friedman for her guidance on the initial conceptualization of the project. When I wrote the grant for the initial funding, Darcy was my mentor. I was working at the Sweatland Center as a postdoc, and for the Center for Reducing Health Disparities for their ongoing support throughout this project. And then the funding as well. So this study is funded through the National Institute of Minority Health and Health Disparities through a pilot award from the Center for Reducing Health Disparities. And here's my contact information. If you have any further questions or want to connect or get involved in any way, please feel free to email me, and I will take some questions now.
Well, thank you, Elizabeth, so much for the presentation, this excellent presentation. And there are many questions coming in, but first of all, I'd like to acknowledge, like that we had such a great number of attendees. We had at some point over 50 people attending this conversation, and we've seen like OSU, from OSU, from Metro Health, from Case Western Reserve, like different departments. So thank you all for like your participation in this seminar. We have several questions actually, and I'd like to start with Ms. Marilyn Burns, who has asked if she can ask a question. And Ms. Marilyn, I'm going to unmute you now, and you should be able to talk now. Ms. Marilyn? No?
Looks like she's still muted.
Yeah, let me check.
Can you hear me now?
Yeah, we can hear you.
Good morning, Elizabeth. How are you? It's wonderful to see you. I think this is a wonderful project, and I understand it totally since I am from a low-income redlined area, and I understand what these youth are going through. I see it each and every day. So one of my questions would be, how do the youth see themselves shifting the outcomes that's happening in their neighborhood? And then the second question was, how did the consent process go? Because I know some children are intimidated by their parents on what to say. They're afraid to say what they really feel. So you don't get the true value of what's really going on. So I was wondering about that, because where I live here at Woodhill Homes, that is a big part. Kids are just afraid to say what they really feel because the parent is there, or they're intimidated. So how did all this work out?
That you bring up a really good question and a really good point. So I can tell you how it worked out, but also some challenges. So just to kind of address the second part while it's fresh on my mind, that was a huge challenge, I think, with the remote option, because children we realized they were doing Zoom, but they're often in smaller homes or crowded areas, or even if they're in a bigger home, just an area where their parent is present or other family members or friends are present. So I think it for some of them really hindered their ability to participate honestly and openly. For the Central Youth Group, the majority of our data collection was in person at the rec center, where they felt very safe and supported, and where it was just the youth and then a couple of the facilitators. And so we did both parental consent, so parents consented to have their children participate in the studies since they were under the age of 18. But that was a consent form that they signed that spoke about the broad aims of the study, and it didn't, the parents at that point didn't have the right then to have access to the things to like the focus group transcripts or anything like that. They said it was okay for participation, but then the youth also consented to participate, and were told that we wouldn't share any information that they weren't comfortable with sharing. So if a young person wanted to speak about something that they felt intimidated to talk about in front of their parents, like for example, if they were like using drugs or drinking alcohol or something like that, they may not want their parent to know. We wouldn't share that in our results, or if we did, we would make it so that young person couldn't be identified. And so
I'm sorry. And then I'm really interested in the first part of the question. How do you feel like shifting some of the outcomes that's happening? I know there were a lot of things that they want. They had a lot of asks. And we're doing the same things in our neighborhood, especially with the transformation that's going on here at Woodhill Homes. So what do they bring to the table as far as what they could do as youth, as far as shifting some of these outcomes?
So there was, the youth had varying sort of levels that they wanted to be involved or engaged. And that also raises some important questions too, on like where the responsibility is and how much is on the individuals and the youth who are already experiencing a lot of the burdens of conditions outside of themselves, and then how much is up to them. So we do have a number of youth who are very passionate about continuing to make a difference in their community. So they want to mentor younger kids. They see that as important, that safety to them really meant not only about safety from the physical environment, so kids needing to be physically safe, like after school, but emotional safety because of things like bullying and negative peer influence. So they want to be positive influencers in helping to run programs with younger kids to create safe physical spaces and emotional spaces, especially during the out of school time hours. Other youth who maybe don't have the time or are not interested in getting involved to that degree, just realize that there were smaller things they could do in their lifestyle, such as like the ways in which they engage in social media and to not contribute towards like some of that bullying or things like that. So that it really varied, but they did see themselves having some power and control. And then they also definitely made the connection that there was a lot about their environment that felt outside of their ability to change, and that they needed support and collaboration from adults in the community, such as people in city council and city planning that could help undo some of the injustices that have created the inequities in their environment, such as unequal schools, playgrounds. There's a playground in Central where the bridge has been like collapsed for a year and little kids are still playing on it, and there's nails sticking out of it. Like why that bridge to that playground hasn't been fixed in a year, where in other neighborhoods it would probably be fixed in a week. Those are initiatives that they need help and support from adult leaders to change.
Elizabeth, there are a couple of other questions coming here in the chat, and I think like that your last comment is actually a great segue into one of the questions from Lisa Sanders. She just posted it. Said, "How are other adults funding local government involved? It would be very difficult for youth to have the ability to change without help and support." And I think it speaks back to the fact that you mentioned during your presentation that you guys are working on an implementation plan as well. And also, probably you are also working with managing expectations of the youth, right? Not over-promising too much of what you, and just actually doing what you actually can do. So would you mind like commenting or answering her questions? Again, her questions is, how are other adults funding local government involved? It would be very difficult for youth to have the ability to change without help and support.
Mm-hmm. Yeah, and that's a great question and a big challenge. And so we tried from the start to do a number of things. First of all, before even collecting any data from the youth, to let people who we believe to be important stakeholders know about what we were doing so that they could be involved. So we had several meetings with different members of city council to let them know, and they then were very open to hearing about our results and even what we were learning along the way. So by introducing the project early on, then when we're like funneling that information, they're going to open the email hopefully or hop on a call because they already have showed some investment. And then also managing youth expectations, that we did let them know that we are here to support them beyond the information we collect and the research. And we really have been very consistently meeting with the youth, but it has been hard because they're ready to move forward now. And funding doesn't work that way. So we've been applying for grants. We've been speaking to local foundations, trying to get the support to implement some of their ideas and their actions, and with very little resources. But we have, I think the greatest support that we've received is really from like the smaller youth organizations that have been very responsive and are very resourceful. Some of the community organizations, working with the Central Rec Center and the Friendly Inn, who have just been so supportive of all of the ideas. However, funding is always a challenge. So especially funding the youth's salaries or stipends to be able to move forward with the action. So yeah, it is the most challenging part. And I think in general of like any kind of action research where you can't guarantee the resources to implement the outcome, and you can't guarantee that other adult experts in the field will place the same value on the youth's perspectives.
Thank you so much. And there are a couple of other questions in that, in that regard. And I think it speaks about what is, in a way, the effect of this research on the participants as well in terms of empowerment, but also in as their emotions come out. And Gabriela Celeste, she asked, did racial trauma and emotional healing come up in the work? And if so, how did the young people see addressing these concerns in terms of specific practices and or policy change?
It came up, but the youth didn't define it as racial trauma or, necessarily, but we did do, part of it could be also related to some of the other activities that we did with them. So we did take the youth to the Undesign the Red Line exhibit, for example. And so they learned, many of the youth already knew about it, but other youth learned more about the history of Cleveland and city planning and some of the historical racism that's happened. And many of the youth made that connection to what the inequalities that they were seeing today. But they didn't really identify or label it as what they were experiencing as racial trauma. They spoke a lot about crime and experiences of trauma in relation to witnessing violence in their community. That really was like a key priority. And so we really created the space to listen and to hear them and to validate what they were feeling and experiencing. We also worked closely with other organizations where we could make referrals if we felt like youth needed additional counseling support. I do have training in clinical psychology with children too, so I helped kind of use that training to also train the facilitators to be just good listeners and to create that supportive space, and to also train the youth to create that supportive space for each other. And the youth did identify that sense of that safety and that social support to be really helpful. But because they didn't specifically speak as much about racial trauma, they did speak about racial profiling, especially from the police, like being a youth, the black male, being a black male in Central and being pulled over by the police for no reason at all, just for walking through your neighborhood, for example, that they connected that to like racial discrimination and having a negative emotional impact on them. So there were those kind of things, but they didn't, the main action they had to address that was related to developing better relationships with police, because they did also feel that the police were needed and that there were a lot of innocent people in the community being targeted. So they wanted support from the police, but they didn't want to be bothered by the police just because they were Black. So I hope that answered your question.
Yeah, and Tim Chiselski from the Sutherland Center has a question too, and as I unmute him so he can ask his question, I'm thinking too about like the reality that community-based participatory research, it's really a challenge in itself, right? And I just want to congratulate you for this effort of inviting the community to participate in doing their own research as well alongside you guys, as you are trying to also motivate others to come into the community to like balance those like power relationships, which it's challenging itself. And also I can see how, because of experience, we are, the communities live around Case Western Reserve, OSU as well, and our universities are in the communities as well. And I'm sure that that's also a hard balance to manage so many researchers coming to our communities and the expectations like that the community have. So thank you so much for that, Elizabeth. And these answers have been great. I'll unmute Tim, and Tim, I think you can, you're unmuted and you're able to ask the questions in that regards.
Okay, thank you. And thanks, Elizabeth. I think, this is a great talk, and I really appreciate that you highlighted underappreciated perspectives. This work's not easy to do with any group of people, but this is a group that doesn't get enough attention. The ideas that the children listed really seem to have a lot of potential. They sounded feasible and actionable, and they already have community support, which is really exciting. As was looking at the list, I almost wanted to look at it longer, because I'm wondering if you guys see, if when you were doing this, if you saw or they saw any fundamental causes or unifying causes or local government policy options. The ones that sort of popped into my head as I was looking at it were things like well-paying jobs for youth, or community safety programs or policing that have the goal of creating maybe not totally safe neighborhoods, but more safe areas within these neighborhoods. That was a lot there, but just some thoughts that maybe you could speak to. And thanks again.
Yeah, absolutely. And they really did feel like, more than they necessarily identified it as like structural racism, which is also a very technical term that we use that young people may not use. They really made the strong connection between what they were seeing in terms of like safety with economic opportunities. And so they spoke a lot about that if people had, including youth, had more economic opportunities to address poverty, that they wouldn't be seeing a lot of the crime that they're seeing in their community. So they did recognize that one way to address even youth well-being is providing better paying jobs and education as well, because they recognize that without that fundamental, like foundational education, such as learning how to read in grade school,
Yeah.
that it's perpetuating poverty in their neighborhoods. And so I think, that's a huge policy level change that needs to happen, but also like things organizations can do. They also recognize that jobs for youth can be very helpful because they spoke about many of the youth had jobs themselves and how it kept them busy, how it provided, they were able to go out and buy the things that they wanted that their parents may not be able to afford. And when you're a teenager, having nice clothes to wear to school can be very important. And if your parent doesn't have a well-paying job, they might not be able to provide that. So you might turn to alternative means to get those things. And so they spoke about how not only did a job keep them busy and in a positive environment, but it also allowed them to get the things that they felt were important for their well-being, which for some could, not that all kids who can't afford it would turn to crime or anything, but for some they felt like it definitely prevented them from even exploring that option. So that was a huge fundamental cause that they recognized, and one of I think has one of the biggest kind of policy implications related to our study.
Cool, thank you.
Thank you, Tim, for asking the question. And Elizabeth, there are just a few minutes before we before our time ends, but I think there are a couple of questions that we haven't been able to answer here, but I'd like just to mention, maybe it's for future work, but for example, Kathy Plummer said, since Clark Fulton is currently involved in a neighborhood master plan, is there the opportunity to engage the youth from the West Side in the master plan process? That was one question. The other question is, can we share the Cleveland Wellbeing Survey with our networks? That was asked by Gabriela Celeste as well. So perhaps just 1 minute to speak about next steps in your research and in this project in particular.
Yeah, absolutely. So we are still connected with youth in Clark Fulton, and what the youth decided was to sort of take a small break so that when it's safe to meet in person, we can resume, because they were just feeling a little overwhelmed by all the Zoom meetings and things. And so we still intend, and hopefully with schools intending to open up in March, we can also resume in March. We intend to re-engage young people in that community as soon as possible. And we would like to recruit more youth at that point, and then also more children to be involved before coming up with sort of solidifying our action plan, because we feel like we've just had limited perspectives, which are very valuable, but we'd like to include more young people. So we hope to do that in March. So if any of you are working in the neighborhood and would like to get involved, please, you can contact me directly through my email, and I would be happy to share more information or to collaborate, because we would love to definitely be more inclusive of the young people on the West Side and their perspectives. And we're also going to include more young people on the East Side as well, especially in the 9 to 12-year-old group when it's safe to meet in person. And then there was another question, I think, that I didn't answer.
Sharing the Cleveland Wellbeing Survey.
Oh, yeah, absolutely. So if you are interested in the Cleveland Wellbeing Survey, you can also contact me, and I'll share the link with you so you can share it in your networks, and we can gain the perspective of additional youth and see maybe how things have changed too, now that youth are sort of have probably adjusted a bit more to the different challenges, and have hopefully accessed more resources than they had back in June, such as internet connection so they can attend school and things like that.
Sadly, our time has come to an end, but once again, Elizabeth, thank you so much for this great presentation that's made us think about our research, community-based participatory research, and particularly involving youth and the role that they can play in changing policy. Thank you to everybody who has participated in the seminar. It was great to hear from you. We'd love to hear your voices, your comments, and your questions in the chat as well. Until the next seminar in February, we invite you to register for it and continue these conversations. Thank you so much and have a great day.
Thanks, Roberto, and thank you, everyone. And also, if you'd like the slides, you can email me too, and I'm happy to share them.
Thank you, Elizabeth, and we'll post them also in our website.
Okay, great. All right, have a great day, everyone.